Okay, everyone. Thank you so much for joining us this lovely Saturday morning to talk about breast health and relationship to nutrition and physical activity. I'm really excited. We have a great panel today who are experts in their field. So I'm just going to introduce everyone. First, I have Maggie Gooding. She is our very own clinical dietitian at Stanford Tri-Valley and at Stanford Pleasanton Cancer Center. She works very closely with our cancer patients and provides invaluable guidelines to help treat the cancer patient during, before, and after diagnosis. So thank you for being here, Maggie.
Thanks for having me.
Next, we have Jennifer Johnson, who is a fitness coach and a triumphant survivor, thriver, and champion in the face of triple negative breast cancer. Yes. Her journey fueled her passion to empower others through fitness and a resilient mindset. So very excited to have you here with us today, Jennifer.
Thanks for having me.
Next, we have Janice Benton Tafara. She is a dietary technician. She works very closely with cancer patients in helping to provide recommendations as far as the correct foods to eat and just being a listening ear for patients when they're in need. So thank you very much for being there with us. And last but not least, you probably recognize Geneva Clay. She was at our very own Breast Cancer and African American Conference that was hosted by Pamela Ratliff, who's here also. So Geneva Clay is an accomplished fitness professional and former award-winning competitive bodybuilder. She's a specialist in holistic and integrative cancer coaching, healing, and support that fills the gaps in traditional treatment plans. She passionately and energetically speaks about the importance of obtaining and maintaining good health through living actively, eating healthy, and managing one's weight to individuals and community-based organizations throughout California. So thank you very much for being here with us today. And then you all have met me before. Dr. Candice Thompson. I'm one of the breast surgeons at Stanford. I operate mostly at Emeryville and Pleasanton, as well as the other locations at Stanford. And these events are brought to you by a grant that was obtained through Stanford Cancer Institute. And we also have a partnership with Touch, the Black Breast Cancer Alliance. And they have provided you all with your lovely bags, for the Love of My Girls bags that have very valuable information that I implore you to bring home to your family and fill out so that you can talk about breast health and family history of cancer. So before we get into the panel, why are we here? I like to show these statistics just so that we are aware exactly why we're here. Within the Black community, Black women are 41% more likely to die from breast cancer when compared to white women. We have a 71% higher relative risk. We also have a 31% higher mortality rate, which is the highest of any ethnic group in racial or ethnic group in the United States. We're also diagnosed with de novo metastatic disease more often than others at a 58% higher rate, which means whenever we're diagnosed, we're found to have metastases that have already spread other places in our body. We also have the lowest 5-year survival rate, which is 81%, which is lower than 91% for white women, and we're just as likely to have genetic mutations. We also, as you all are aware from the previous talks, are more likely to have denser breast tissue, which correlates with a higher chance of things being missed whenever we get normal mammograms. And when it comes to triple negative breast cancer, we're 3 times more likely to be diagnosed with triple negative breast cancer, which has some of the poorest survival rates. And when it comes to young Black women, we are 2 times as likely to be diagnosed under the age of 35 and 3 times as likely to die from breast cancer under the age of 35. So that's why we're all here, to try to improve these numbers and learn so that we can have better results as a community. Okay? So let's get into the questions. Don't be afraid to ask any questions throughout all of this, but we'll have time at the end also to ask questions. So before I get started, did everyone fill out the first page of the survey? Okay, perfect. So just a question for everyone. Is nutrition related to breast health? What does everyone think? Yes, okay, overwhelming yes, okay. So, Maggie, I'd like to hear your input on whether or not you think nutrition is related to breast health.
Okay, absolutely, nutrition, oh, sorry. Absolutely, oh,
Sorry.
sorry about that. So yeah, nutrition is definitely related to breast health. Diet is thought to be at least partly responsible for about 30 to 40% of cancers. And being overweight and obese is a significant risk factor for breast cancer. So following a healthier diet that's lower in fat, lower in calories, will obviously help to decrease our weight as well as our body fat, especially after menopause. What we don't realize is that when the ovaries stop making estrogen, the estrogen can actually come from fat tissue. So the more fat tissue we have, the higher, again, our risk for breast cancer is, because we are still having these high circulating estrogen levels in the body. So following a diet that's generally lower in fat, lower in calories, and then plant-based, which I'll get into a little bit later, which has cancer protective benefits, will all help us, kind of help to decrease our breast cancer risk and just, improve our breast health. And I will say that countries that do typically follow a lower fat, plant-based diet tend to have lower rates in breast cancer. So definitely have been studies that do show that nutrition is absolutely related to breast health.
Yes. Thank you very much for that excellent answer. So, one of the things that Maggie mentioned that I just want to harbor on a little bit is there is a lot of research in this area, especially surrounding your weight with whenever you're postmenopausal. That's especially when it's important to try to keep your weight at a range that is a normal or average body weight, to try to decrease the amount of circulating estrogen that can increase the risk of breast cancer. So thank you very much, Maggie. Next question. Is physical activity related to breast health? So I'm going to ask Jennifer first to go, and then Geneva, and then Maggie.
So yes, so physical activity is definitely related to breast health. Studies have shown if we get the recommended at least 150 minutes a week of moderate to intense exercises, that can help decrease our risk for breast cancer, and also improve the prognosis after diagnosis. And it also helps us to get to and maintain a healthy weight, which in turn will help to regulate those hormones that Maggie was just talking about, which will also help to decrease those risks as well. 150 minutes a week. So that's like 30 minutes a day, 5 days a week, or, chop it up how you like it.
Okay, thank you, Jennifer and Geneva. Oh, thank you. So the question was it 150 minutes a week? And
Yes. The answer is yes. So at least 150 minutes a week of moderate to intense exercises.
Thank you. Yes.
So when moderate exercise, does that count as, say, you walk for 30 minutes a day? Does that count as moderate exercise, or you would have to actually get your heart pumping?
So the question is, what exactly is moderate exercise? Is that just walking, or what is it exactly? How do we get our heart pumping?
Yes, so moderate, it's different, it varies by person, obviously based on your heart rate. But for some, that's walking, it could be a brisk walk, it could be biking, a little bit of dancing. But yes, so it's a moderate, consistent of that time. So if you can do 30 minutes a day for 5 days a week, or however you want to break it up, but it's moderate to intense. And it tends to be more like high intensity stuff like running and things that will get your heart rate up, right? So you'll be breathing heavier and things like that. So that's the intense piece.
Thank you. Great questions. Another question? Yes, thank you for that comment. And for those who didn't hear, the comment is also includes swimming in the list of moderate to intense exercises. It's very good for people who are going through treatment, as long as you're cleared by your doctor or your surgeon. And it's also good on your joints, so it's a very good moderate to intense exercise. So keep in mind swimming. Thank you. Okay, Geneva. Again, the question is physical activity related to breast health?
Um, Yes, it is. And to piggyback on what Jennifer has said, I'm going to look at it from two perspectives. And Jennifer talked about the guidelines of 150 minutes, 30 minutes, which equates to 30 minutes a day. And you can break those 30 minutes up into like 10-minute chunks. So you don't have to feel if you don't have the time, and if you're starting out, to do it all in one segment. So, bite-sized pieces. And moderate intensity, also to expand on what Jennifer had, her response and other questions. Moderate intensity, you can also look at it as, can you talk? So you can have a conversation when you are engaged in a moderate intensity type of activity. So walking or anything but it still gets the heart pumping. What is vigorous intensity? You can't carry on a conversation. So that's brisk walking or jogging or any activity that you can't have a conversation with your neighbor. So strength training is another part of, I'm looking at it from an outward perspective and an inward perspective. So the outward perspective is that physical activity, the walking, the swimming for 150 minutes. And I thought about that earlier this morning. We use that 150 minutes, but when you really kind of break it down in English layman's terms, it is really 30 minutes. 30 minutes a day, again, broken up in little small chunks. And aerobic exercises we talked about. Now I want to talk about it from an inward perspective, an inward holistic perspective. And that means incorporating practices that includes meditation, mindfulness, prayer, gratitude, because stress management can potentially impact cancer. So when you look at physical activity from an inward holistic perspective, you then get those results of more of a calming nature. You are able to see things more clearly when you're looking at it from that kind of holistic inward perspective. So what are some of the things? Again, I talk about mindfulness and meditation practices, deep breathing, just sitting and being grateful and being in charge of your emotional well-being. Also looking at incorporating yoga and Pilates, which stretches the body and then also get you in that frame of mind of just relaxation and a stress ease. And prayer.
Yeah.
Prayer is so important and that's a form of physical activity. It could be everything, but it can also be a form of physical activity. Forgiveness. Practicing forgiveness of yourself and forgiveness and embracing that diagnosis and forgiving yourself for it. And then practice gratitude. What are you grateful for? Being able to wake up and see another day. So those are some of the physical activity from a holistic perspective and inward perspective I would like to add to what Jennifer has mentioned.
Yes, thank you very much, Geneva. All of those things are very important, especially stress management. We will be talking about that at a later session, I believe the December session, so look out for that. We'll talk about how mindfulness and stress, because there is a lot of research about stress and its relationship to cancer. So thank you for that, Geneva. And then Maggie, does physical activity have a relationship to breast health?
It does, and I definitely talk to my patients about, some physical activity when I'm giving them nutrition counseling. I piggyback on what Geneva and Jennifer said, the 150 minutes a week, break it up into those small increments. If you don't have a background in, exercising, or you're very weak, even I tell them start with, a goal of 60 minutes a week and, 100 minutes the next week. Work it up, but just be consistent so that you can reach that goal and actually stick with it. And do it long term. But kind of going back to the kind of body piece of it, going back to the hormones, I think, again, because our body creates more estrogen when we have excess fat tissue, when we do physical activity, we're able to, burn that body fat off, so that decreases our estrogen levels in the body. Also, exercise helps with insulin sensitivity, which is how our body our cells are responsive to insulin. So when we have lower fasting insulin levels, then we have a better outcomes when it comes to breast cancer. So women who have higher fasting insulin levels tend to have poorer outcomes in regards to their treatment or their diagnosis, their prognosis. And so I think all of that is really important to kind of help, with decreasing, again, our risk. And then, as we mentioned, the stress. I think when we have a lot of stress in our body, it increases our cortisol levels, and that causes belly, a lot of fat to build on our body, especially in our belly area. And again, it's that whole cycle of those hormones just that are kind of messing up our system and increasing our risk. So absolutely, physical activity is related to.
Thank you, thank you. Those are all extremely important points. Your body is not just, or breast cancer is not just an isolated event in your body. Everything works together. And as Maggie said, it's really important, especially surrounding surgery as well as treatment, to be the healthiest you that you can be if you are in that situation, so that you do have better outcomes. Okay. One quick thing for all of our, everyone who's just joined, please make sure you fill out the first page of the survey right now, please. Thank you. Yes, someone had a question?
How does it affect women who've had a full hysterectomy, who does not have all of those symptoms?
So the question is, how does,
Where she said the estrogen?
how does estrogen affect women who have hysterectomy?
Yes.
So if you've had a hysterectomy, or even an oophorectomy where your ovaries are removed, there's still estrogen in your body. There's estrogen floating around in everyone's fat cells, males and females. So you'll still have estrogen within your body. And if you have excess fat, then you can have extra estrogen in those fat cells that can exacerbate things sometimes, especially if you have a history of breast cancer. It can increase your risk for recurrence. Great question. Okay, so next question. The next question is there anything that we can do that has been found to be preventative? So I'll let Geneva go first, and then Maggie again.
Yes, there's several, but I'm going to talk about 4 preventative action steps Geneva's way. So the first thing that has been found to be preventative from clients that I've worked with is their ability to tap into their own power and have a healthier life. And that's important. We don't, that word and that type of practice is not exercised a lot, but being able to tap into your own power is really powerful and empowering to eat your way to a healthier life. So you have all of the guidelines from a dietitian perspective, of how we should eat, and we know we should eat more of a plant-based type meal. So we hear that, we know that, but how do we really make that a part of who we are and what we do to make that a lifestyle change? And that's by tapping into that inner power. And what are the ways to do that again? By practicing mindfulness, meditation, prayer, forgiveness, and have those type of gratitude practices. And replacing should with, I get to do this. Oh, I know I should eat healthier. I know I should exercise. I know I should. And versus saying that, or I get to eat healthier. I get to live another day in this wonderful body of mine. I get to enjoy all of these wonderful foods that will fuel this amazing body of mine. And then repeat faith-filling affirmative words to yourself. And repeat that on a consistent basis daily. And number two, eat well. You know what this is going to be, the theme is make conscious and wise healthy eating choices to reduce your cancer risk by making smart choices, by adopting a well-balanced diet. And Maggie and Jennifer, I'm quite sure all of them will be able to provide some guidelines. I believe there's some handouts as well. But make those smart wise choices. Be well. And I like this, achieve physical activity excellence, whatever that means for you, because it's different for everybody. So move your body with intention. So even if you're walking, walk with intention. If you're swimming, swim with intention. If you're dancing, dance with intention. So whatever it is that you're doing in terms of movement, do it with intention and a sense of gratitude that you get to do this. You get to move your body. You get to move it with intention, and you get to have the benefits as a result of it. So start looking at it that way, and then reward yourself. All too often we don't give ourselves that ability when we've achieved a goal. And it doesn't matter how big or how small that goal is. And it doesn't matter the type of reward. Just reward yourself. Even if you just give yourself a hug or, go buy yourself just a little treat. Reward yourself. Live well. Again, the question is, what can we do to prevent our cancer risk? Again, I really believe in tap into that inner power. So experience the empowering feeling of being in active control of your life, no matter the circumstances or condition. And so what does that mean? It means you don't have to be perfect. It means our body doesn't have to be perfect. But tapping into that and aiming to be 1% better each day. Or if 1% is a little bit too much, 0.005. It doesn't matter, but strive to be 1% better, whatever that is for you each day by eating healthier, moving more, and again, engaging in some form of mindfulness practice, prayer, gratitude, forgiveness.
Thank you very much, Geneva. Maggie, is there anything that we should do that has been found to be preventative?
Yeah, there's a lot of evidence regarding nutrition and what we can do to kind of decrease our cancer risk, not just breast cancer, but all types of cancer. It's a long list. I'm going to make it short. But number one is, as Geneva mentioned, consuming, I like to call it a plant-forward diet. So this doesn't mean that you have to be vegan or vegetarian. It just means that the proportion of your diet is going to be largely plant-based foods and less in the animal food space. And I'll go into that a little bit later in the further questions. But just eating more of a plant-based diet. Limiting our red meat to no more than 12 ounces of cooked meat per week. So that's going to be things like pork, beef, lamb. We want to limit those to 12 ounces or less, if possible. Limiting our processed meats, so things like lunch meats, salami, bacon, pepperoni, things like that. We want to limit those because the basically the preservatives they use are carcinogens. And so if we consume them in large amounts, they increase our cancer risk significantly. So avoid them if we can. If not, I always tell patients, once a week you have bacon on a Sunday, you have a big breakfast for, for the weekend, or, you're going to go out for pizza with your family. It's fine, but just trying to limit how often you're doing it and really try to limit those as much as you can. Limiting your processed and refined grains and flours. So consuming more whole grains. Think things like whole wheat bread, corn tortillas, air popped popcorn, whole wheat pasta. And limiting the refined sugars and grains like white bread, white rice, all the like cookies and cakes and all that kind of stuff, like those really sugary cereals. Really just trying to limit those sugar sweetened drinks, cakes, candies, things like that. Aiming for a lower fat diet. Again, limiting your saturated fats, which are going to be found in things like fatty cuts of meat, a lot of butter, lard, cheese. Coconut and palm oils are high in saturated fats. And then also limiting your trans fats, which are found in a lot of processed foods like fried foods, frozen meals, convenience boxed meals that we see on the shelves. They put these trans fats in there because this is how they keep them on the shelves longer without having to replace it so quickly. It's cheaper for the companies to use these cheap oils, but it's harmful to us. Obviously, a higher fat diet again then causes that our weight to go up, which we're trying to avoid. We want to increase our intake of omega-3 fats, so eating more fatty fish like salmon, tuna, mackerel, herring, sardines, eating more nuts and seeds, and plant oils like flaxseed, soybean, canola oil. These all help with decreasing the inflammation in our body, because when we have this chronic inflammation, that can kind of cause mutations in our cells and make them potentially turn cancerous. Limiting our alcohol consumption. So if you drink, we want to, again, if you could avoid drinking, great. But if you enjoy a drink, limiting to 1 drink a day for women, no more than 2 drinks a day for men. And a drink is going to be either 5 ounces of wine, a 1.5 ounce shot of hard liquor like whiskey or vodka or tequila, a 9 ounce malt liquor, so think like a Truly or a White Claw, or a 12 ounce beer. And yeah, that's pretty much what I was going to say. Sorry.
No, you're fine. That was a lot of information.
A lot, I know, I'm sorry.
In 1 second. So it sort of brings us to our next question, which you mostly went over, which is what types of food decrease breast cancer risk?
Yeah, so this is where I was going to go into those plant-based foods and why those are actually good, because I mentioned eat more plant-based foods, but I always like to give the reason why they're so good for us. So again, plant-based foods are going to be things like fruits, vegetables, whole grains, beans, and legumes, okay? And they have a lot of cancer protective benefits. Number one being that they're lower in calories and fat. So again, when we eat a primarily plant-based diet, we're going to naturally be eating a lower calorie diet, which is going to help with weight loss or weight maintenance. These foods are actually also very high in fiber. So fiber helps with helping you feel fuller longer. So again, it helps with decreasing that overall calorie intake. They also help with blood sugar control. So when it helps to decrease our risk of diabetes, or if you have diabetes, it helps to keep your blood sugars under control. Because again, if we have too much insulin floating around in the body, that can also kind of, cause mayhem and increase our cancer risk. It also helps with speeding up elimination of harmful waste within the body. So when you eat a high fiber diet, you go to the bathroom more often. So it helps to keep you clean and not have stuff just sitting in there, kind of, potentially causing issues in your intestines. So these foods are, so good for those reasons, but also they are high in phytochemicals and antioxidants. So phytochemicals are chemicals that are found in plants that can decrease the risk of a lot of different diseases like cancer, diabetes, hypertension, heart disease. And the phytochemicals, their power varies by the type of plant-based food and also by the color. So I always encourage my patients to eat a variety of colors in terms of their produce, because every different color is going to have a different phytochemical property. and a different benefit to how it protects you against cancer. So I want you to eat bright reds, purples, yellows, oranges, even browns and whites actually have beneficial properties. So when you're at the grocery store and you're shopping, look for, try to look in your cart and assure that you're getting a lot of different colors. And that it doesn't have to be a specific fruit or vegetable. It's just more the variety of color that's going to assure that you're going to get all those protective benefits. And then also these fruits and vegetables or plant-based foods are high in antioxidants. So these antioxidants are good because they help to protect our body from free radicals. So free radicals are these byproducts of our body's kind of natural processes. And these free radicals can attack our healthy cells and potentially mutate them. So when you're eating foods that are high in antioxidants, it's kind of like a shield to protect you from these free radicals so they cannot attack your cells and cause mutations and change the DNA. So again, eating kind of all these plant-based foods, again, there's kind of a science behind it of why they're so good for us, and many different ways. Again, they help with weight loss, they help with actual cancer prevention and keeping our cells healthy, they help with keeping our system clean, but then again they help with so many other diseases like you said, diabetes, heart disease, hypertension, which is so common in many of us. And so it helps, kind of eating a plant-based diet will help with a lot of different conditions and not just cancer.
Yes, those are excellent points, Maggie. Thank you very much. I think I had a question in the back. That was a great point. And to summarize, the question is, in communities of color and in impoverished communities, there are a lot of food deserts in which people do not have access to fresh produce. There's access to a lot of canned foods or foods with nitrates or additives, and you don't have a lot of options for phytonutrients there. There are a lot of alcohol stores. And what exactly is being done in the community in order to mitigate this issue? And I agree this is a grave issue that needs to be addressed on a higher level. I don't have a particular answer for that. I don't know if anyone on the panel is privy to any policy.
I don't have a particular answer to that, unfortunately, especially like in Alameda County. I'm not quite sure in this area, like if there's any programs. I want to say I think there is one that does help people when they do, like either providing vouchers or providing some kind of assistance with obtaining the foods. I just can't think of it off the top of my head. I will absolutely do the research and I can always get it to you. Or I can get your email after and I can send it to you. I mean, whoever is interested. But what I will say is that when I do have patients who, are in either they have financial restraints, they live in an area where, they don't have a lot of options in terms of fresh fruits and vegetables, I do encourage them, you can always use frozen vegetables and frozen fruits. They are picked right at the peak of ripeness. So you can use, frozen fruits and vegetables. I even know, the dollar stores a lot of times do sell fruits and vegetables, frozen fruits and vegetables. So if it's somebody who is having financial restraints and they say, Maggie, fruits and vegetables are really expensive. I mean, even if you buy little bags of frozen at the dollar store or at the grocery store, that would work. Again, canned vegetables and canned fruits, are they the best? No. I mean, I would prefer fresh. But if that's a way of getting the veggies in you, I always encourage patients, then do it. You're still going to get some of those nutrients from them. If anything, I would just encourage you to, drain them, rinse them, get off that excess salt on them or excess syrup or whatever. But at the end of the day, you're getting those fruits and vegetables in, you're still going to get some benefits. I always get questions as well about, do I have to eat organic? Organic's very expensive. We don't have a lot of organic options in my area. And I tell them the same thing. There's no difference in terms of nutrition between conventionally grown fruit and organic. Sure, there's less pesticides, absolutely. But in terms of the nutritional benefits, they're still the same. And so I would rather you eat the fruit or vegetable, even if it's not organic, but you guarantee that you're getting it in versus not getting in it at all. So, I think we do the best we can. Even somebody who has all of the means, I think, is not always going to make the best choices or always going to do everything perfect. But I think as long as we're making an effort to do the best we can, and if it has to be frozen, if it has to be canned, it's still better than what I was doing last week when I wasn't eating any fruits and vegetables. I'm at least getting some kind of protective benefits now. Maybe small, but it's something. So I think thinking of it that way as well as, what we have around us, using what we can, and hopefully, yeah, we do have more policies or have more grants or have more programs that do provide this help, because I agree, it's hard when you don't have it around you. How am I going to get it? I want to do it, but how am I going to do that? I need help. So yeah, hopefully that will come around.
Yes. Geneva, did you have something that you wanted to say? I saw you reaching for the mic.
No, I agree with what Maggie said, especially because, I think that's really an important, thank you for raising that question, because how do you eat healthy when you live in a food desert? And how do you eat healthy? How do you follow the guidelines that it's put before us by the USDA in terms of what a healthy meal is? And again, that's where I like to look at how do we empower people where they are, you know, and that is utilizing the frozen foods, utilizing, as Maggie said, because I was thinking about that, the canned foods and just rinsing them off. So, I always like to look at it from the perspective of how can we really empower? Because if we just run down statistics and guidelines without really empowering the people how to actually make that a part of their lifestyle, it's going to go in one ear and out the other. So when you live in a food desert, yes, the other options are, maybe local markets, local community gardens that you may have, because there are community gardens in our low income areas. And then again, the frozen fruits and vegetables is also an excellent source.
Thank you. And moving on to our next question, Janice, we sort of touched on this already. How do we implement this diet into our lifestyle? But whenever you're seeing patients, what do you tell them on how exactly they could implement this sort of healthy diet into their lifestyle?
Well, I know that through my experience at the hospital, when they, whatever reason they're there, we're like the third person to see them, and they kind of upset because they're there. They have no control of why they're there. So when they see us, they like, oh. So a lot of times I come at it. We all work a different way, but my way is to make it easy for them, and I know that the only thing they have control of it is the food. And so I just start with, the selections. A lot of times they already have the selection from, it's not very much selection. So I kind of make it a little easier. So I give them the right to choose, not saying, oh, you have to have this because this has to heal this. And a lot of times it's the easier, softer way that I approach is give them the right to choose. And a lot of time most of the time they choose within the menu, but they said, I never ate this before. So I start with the vegetable. I call myself the vegetable lady. I raise my kids on vegetables, and they real taller than me and they healthy. But a lot of times I take the easy approach. I go with the vegetables first, the salads. I do. We're not allowed to mix to make them happy if they're not eating or they're in recovery. I kind of go beyond and kind of mix they say, well, I like everybody likes salad. So I kind of like mix the carrots, the string carrots, start with the greens, or I would do green beans, carrots, brown rice, and I let them have the choice of meat. But then I kind of, most of my patients are diabetics, and I kind of stick with the brown rice and the other stuff on the plate. I do the protein, but they mostly like fish, like I can't even tilapia. That's what the word is. So we stay within the guidelines, and then when they go for the heavier food like the beef and stuff, and we kind of go behind the dietitians and we kind of guide them within the guidelines. So it works out pretty good. So I just tell them, I say, I know it's overwhelming, And they said, we never ate this before. So I suggest try this, and we'll try this the next time I see you, and kind of gradually, and then they start ordering, oh, I like the salad I had yesterday. And I said, okay, we can do this again, but I try to put more color. And I tell them we're very limited as a hospital, and then I move in with the vegetables, I mean the fruits. So first time they'd be like, oh, I don't know, I never ate this, but with the days that they are there, and when they see me, I'm going home, I loved it. They've said they lost some weight, they feel better, and they motivated. And I said, don't try to push it all in at once, just whatever you could afford. If you eat salad is good every day. And she said, I hear you, because you gave it to me every day. So, and then they said, and then they start talking about vegetable. Why you keep giving me green beans? And I said, okay, let me talk to the cook and see what else we have. And it works out. So we kind of get a little, we talk to the dietitian when we cannot help them, or we have patients that I don't want to eat for whatever reason. So I kind of like, I still go and see them. I sit down and I talk to them, and I want to hear what they have to say. Because somewhere in that conversation, I can pull something. And I say, what about ice cream? So I stick with the more low fat. I stick with the colorful vegetable. I say, I want to tell you that I'm Janice. I'm a vegetable lady. They say, what you mean by that? I like to implement food. I like color. The more color, the more nutrients that you can get from each color. So she said, you have this. So it works out. If you just have a salad and some fresh fruit, and we dealt with the fruits, we're very limited, but we also can talk to the doctor, talk to the dietitian, and they usually make them happy. So that was I said, well, that's what I can give back to her. So we stick within the greens. I'm not so much a protein eater. I look at myself, what if I was in their position? How can I do? My job is to make sure they eat. And a lot of times they do. But you just have to make sure that they're in control. Once they realize that you take that control back, oh, you're going to give me this food and I'm not going to eat it. I say, well, wait a minute. Maybe I can be a little lenient. Maybe I can talk to someone. So usually the dietitian comes there. She works with them. And when I come back, she said, I seen the dietitian. I'm so happy I can have this. So it works out pretty good. And then when they return, which we still, and they'll say, well, the diet is different. They went home and they went to the store, they got it, or I got this so it ends up being very happy people leaving the hospital, and then they take it on to their home and they start changing their diet. But I told them what I'm saying to you is, if you don't have it, just work it in. If one day eat this, one day eat that, but the salad is, play with the salad, throw some, bell peppers and stuff, so it works out.
Thank you. Those are very important points, Janice. And one other point that you touched on is patients, whenever they're in the hospital or going through treatment, sometimes the diet can change a little, or the appetite can change. So, Maggie, what do you generally tell breast cancer patients after they're diagnosed and like while they're going through treatment?
Well, first I want to say I love your approach, Janice. I think that's great, and I'm sure your dietitians are very happy to work with you, because I think it helps when you have a team effort going towards the patient. But I like to, again, encourage my patients, immediately to kind of try to follow that plant-based diet as soon as they can. But I understand that, a lot of patients, this is completely new to them. They've never eaten like this. So I always get history from them. How do you normally eat? Okay, now what can we start working into your diet, day by day, week by week? Because I want this to feel natural. I want it to become permanent. I don't want it to be like a complete shock to them, where then they follow it for a week and it's so hard that then they completely go off of it. Especially, when they've been diagnosed, they already have so much stress. And like Janice said, this is one thing they can control. And I want them to enjoy their food, because food for so many of us is love, it's family, it's nurturing, so I want to continue that. I don't want it to feel like medicine. Even though it is medicine, I still want it to feel like something that they enjoy even through their journey. So again, I think I tell them, take small steps, whatever we can do week by week, let's work that in. Obviously, depending on their treatment plan. So if they're going to go into chemo or radiation or surgery, that may affect their appetite and they start to have really rapid weight loss or they're having nausea, vomiting. So in those situations, I work with patients to liberalize the diet a little bit. And like Janice mentioned, maybe allow some ice cream. I allow them what they can tolerate, but generally, if somebody is feeling pretty good through their treatment, I still encourage them to follow this healthier diet as much as they can because even during treatment, 1 to 2 pounds of sensible weight loss is still beneficial, even during treatment. Again, as long as your energy levels are good, you're coming out of your treatments week to week or whenever you're having your treatments, you're coming out feeling okay. It is still good to kind of follow, just get these healthy habits going because I do want it to feel natural and become just a regular part of your life, really.
Thank you. And then as far as your patients who have breast cancer with regards to diet, tell me what you tell your patients as far as like how to implement this, I guess, and what to do with their diet. Like, should they do a fad or like go on the Atkins diet or something?
Yeah, again, I mean, this is a diet that I think is beneficial for everybody should be eating like this, whether you have cancer or not, or any kind of disease. This is just a better way of eating for all of us. And so, again, I really try to encourage them to implement it, quickly and do it at their pace, taking into consideration their culture, their food preferences, their food allergies, whatever they like. But I never want it to be something that feels like it's temporary and then they're going to go back to what they were doing. Because once you're diagnosed with cancer, you have a higher risk of either that cancer recurring or getting diagnosed with a different cancer later on in life. So just because you're in the clear and now I've been in I haven't had cancer for over 5 years, I'm good. It doesn't mean that later on down the road, you're not going to get another type of cancer. So I want people to be vigilant and continue this kind of eating plan. And just know that these foods are so beneficial, again, for so many different reasons, that I want this to be something that you're going to continue for the rest of your life. And so that's why I want you to work it in slowly, because again, I want it to feel like this is just natural. Like Jana said, now they're used to eating salads, and I'm going to just adjust my salad. It's something I really enjoy. Work things into your diet as you can. Still allowing yourself, I don't want people to be afraid to eat and like, oh my gosh, I shouldn't eat sugar. I should never have this or that. I can't have alcohol. I want you to enjoy life, especially after a cancer diagnosis. That's such a stressful time of life, and I want people to still feel like I want them to live, but just always keeping in mind that everything I put in my mouth has a consequence to it. And whether it's good or bad, I just want you to always remember that, and if you do allow yourself things that aren't healthy, there's a reason behind it. It was my birthday. It was a hot day and my grandkids wanted to go have ice cream. I'm going to do that with them. I'm not going to completely take away the joy in my life and not eat the things I like, but moderation, portion control, maintaining that physical activity so that you eat it and it's done with, and it's not gonna be something that you continue doing and these negative, it's like a negative thing that continues. It's like you eat it and then you're done and you move on. You don't let it overtake your life, but again, you do enjoy life. Especially again, after, such a devastating diagnosis. Nobody ever wants to hear that they have cancer.
Thank you. So you sort of touched on physical activity, and I know, Jennifer, that played a huge role in your journey and your recovery. So can you tell us a little bit about your journey with cancer and how physical activity played a role for you?
Yeah, for sure. So my fitness journey started about 10 years ago, and I started with a fitness goal of just wanting to be able to run a mile. So I worked with a really big coach and had, pretty much determined to get to that 1 mile stage. So I got there, completed it. That goal ended up transitioning to now I want to do a 5K. So she worked with me to do that, and I developed a love for running. And then I ended up doing a little more in strength training, and I had a goal in 2017 to do a national bodybuilding competition, and I did that. And my first show, I placed third. So I just kept making different goals, right? And throughout the time of my fitness journey, my goals would change, like they'll evolve, but my purpose was always just to be able to stay healthy and fit. Like that was my thing. That's what I wanted to do. And then so I ended up taking that on to wanting to be a health coach myself, and I started teaching at a local fitness club group classes, and became that hiker and friend that everyone loved to hate. Come and call you on a Saturday morning at 6 and say, let's do a quick 10-mile hike. And it's so great, let's do it. And so doing that, I really found a passion for fitness. And so in September 2021, I was really shocked to find a lump in my right breast. And I was like, this shouldn't be here. And especially at the age of 38. So I, went to get it checked out, and eventually found out it was in fact cancer, and it was triple negative breast cancer, which is what Dr. Candice mentioned. It is the most aggressive subtype of breast cancer. So in so many, there's no, at the time there wasn't any targeted therapy for it, so they pretty much like threw the book at me in treatment. So I had like 20 weeks of chemo, and that was followed by like 30 rounds of radiation. And during that time, like it took a toll on me, like pretty tough. And but I still had the same goal. I just wanted to stay like healthy and fit, and so that looked different. I couldn't do 10-mile hikes, I'd be lucky to do like a 1-mile hike, and sometimes it was just a hike up my stairs to lay in my bed. But I was determined to move and stay healthy, and also listen to my body even when it said like to just lay down. And then so I completed treatment in June of 2022, and there was no evidence of disease, and I came out like really great. And I really attribute the success of my treatment to my fitness journey. The fact that I was able to continue to work, I was continuing to teach my classes, do my demos and things like that. I had very minimal side effects. I had I lost my hair, I lost nails, a lot of lashes, but those all came back, and I got extensions and all that, right? So that was good, but more importantly, like I didn't have bone pain, I didn't have neuropathy, I didn't have heart issues, I didn't have lung issues, and I know like all that was God, and I was so thankful and blessed for that. But it really, attributed to that. And so throughout my entire fitness journey, even before, obviously no one expects to get cancer, and I was doing all the right things, right? And so I felt like, God, why me? But at the time, like literally told me like, why not you? You got this, right? And so he had me the whole time. But I really attribute like my fitness to just coming out on the other side and being here to tell you all this story today, the importance of investing in yourself when it comes to fitness. And I do want to encourage you, like no matter where you are in your fitness journey, whether you're just starting or thinking about starting, wherever that is, like find something that you love to do, like whether it's swimming or dancing or walking. Find something, dial into it, take that time, 150 minutes a week, make it 10 minutes or 20 minutes here and there, whatever you can do, because that investment that you put into yourself will definitely repay you tenfold. And I'm here to, as proof, right? So I encourage you to do that, and stay healthy, happy, and whole. That's why we're here, right?
Thank you so much for sharing your inspirational and amazing story. And I definitely agree that I think that physical activity and mindfulness and your mindset and being able to have lower levels of stress during that time period definitely impact things whenever you are diagnosed with cancer. So thank you again for sharing your story.
For sure. Thank you.
Can I add on to that really quick?
Oh, sure.
There's actually been studies that have shown that people who continue their physical activity during treatment, that continue to have positive attitudes, meditating, doing yoga, just, having less stress during treatment, do have better outcomes in terms of their recovery, from chemo to chemo, treatment to treatment, or just in general, their prognosis at the end of their treatment. They do have better outcomes. So I always encourage my patients, it's like I turn into a psychologist, and I'm like, it's not, I know we're talking about food, but then we get into other stuff, and I'm always like, you have to just stay positive. This is just a period in your life that is rough, but you just get up every day and you have to just do it and just, put your best foot forward. And I promise you that you will have better outcomes. I mean, there's been so many studies on it that do show that having that positive attitude, and I'm sure Geneva, you will attest to that just having that mindfulness and that positive attitude really does help with coming out with better outcomes overall. So I always encourage patients, like, just, you have to stay positive, and just focus on the good and focus on the end result.
Yes.
Which is coming out, just like Jennifer did. So.
Yes.
Thank you. Yes, question.
I do have a question, I guess for Jennifer, Maggie, and you too, Dr. Candice. First, I was wondering what stage you found that your cancer was diagnosed at, and also, depending on the stage, will the physical and the mental, like all you do for your wellness, does that also help in recovery for even every stage, like 2, 3, 4, and so on?
Great question. So the question is, first, what stage breast cancer were you diagnosed with, Jennifer? And then the other question is, does physical activity help for every stage of breast cancer, 0 through 4?
Yes, very good question. So I was blessed enough to have stage 1, and that just goes to attest to the importance of, early detection. Make sure you're checking your breasts and use the little pamphlets that we have to remind you to do that, because I found the lump myself. And as I mentioned, I was 38, so I wasn't recommended yet for mammogram. So stage 1, it was it was helpful to be that early, but at any stage, physical activity does in fact improve with your prognosis as far as when you're going through treatment. And it looks different for everybody. Like I said, like some days that's just making a lap around the couch, so, but it's that being able to move and stuff does help with any stage, 0 to 4.
And then I have one last question for everyone on the panel, then I'll open it up to the audience. So the question is, what recommendations do you have for those who would like to see a dietitian or a physical coach who are going through treatment or post-treatment? I guess we can start with Geneva.
So I recommend talking to your friends and families, getting recommendations. And the question is, what options?
What options would you recommend to those in the community
Okay,
as far as
looking for.
physical fitness coach and or dietitian?
So I recommend word of mouth is one of the best ways to get references or options for whatever it is, a physical trainer, dietitian, etc. So that's one way. And the other way is to Yelp. I love Yelp. And Yelp will also spew out results for whatever it is that you're looking for. And then you can just go down the list and look at the reviews that they have. And then also ask your healthcare provider and also your insurance.
Great, yes. And I want to bring up the point that not a lot of facilities or healthcare entities actually provide you with a dietitian. Fortunately, at Stanford, we have Maggie, who is working off of funds that were set aside for her, but not all facilities have that. So that's why we're talking about this. I guess Janice can go, and then Maggie, and then Jennifer.
Well, a lot of times I could speak for myself. I would give advice to the diabetics that a lot of times your primary care doctor would refer you to some of the places. I think you get like for me, I asked for a dietitian, and they used to send me to Berkeley. Most of the patients, I'm with Southern Health, so they would send me to there's a diabetic referral to Berkeley. I forgot. I think it's on Ashby.
Ashby, yeah.
Yes, and they usually, first time I got it, they said 3 days. I said, well, 3 days is not, 3 days is not enough for me to implement all of this. It was so much done. So I think they gave like 3 sessions now for people that want to implement it, but it gets confusing when you first visit because they're like putting this and putting that, and you should watch this. And so, even though you take pamphlets and stuff, I'm a visual person, so I would advise as go to see a diabetic doctor, a dietitian, and if you don't understand, keep going. I think they have more, just say, I just need more. And a lot of time the benefits or whatever, the Medi-Cal or whatever you're receiving, they would give you more. And if they're going to give you more, just moved on. And I think it's a lot of classes on health on YouTube. And a lot of the dietitians went to YouTube, so I found a lot of that for myself. You know, in order for me to, and then as far as you said the physical.
Well, yes, I mean, if you can speak to that.
Okay, the physical, like I say, I only can speak for me. Me and my sister are diabetics, and she's not motivated as I am. So whatever, I have a private trainer only because that's my son. He went to school with my son, and he's like, you could jump on his pay. So it's very expensive for a private trainer. But for me, if I feel like I ate something that I know I'm having one of these days, like stress, life is stress, so I would just eat this little piece of, I wouldn't deprive myself, but they said moderation. Now I can teach it, but to give it to me, it's harder. It's like I'm a patient. I'm fighting with myself. And I would take that cookie. I would take two, and my son said, "Don't do that." I say, "But there's a result behind that. If I eat that cookie in the morning, I know that I have to go outside and shop, or I have to go to the mailbox, or I have to walk around the block 3 times. I want to eat that cookie because it's going to be in my head. Is I'm a food addict? Yes, I am. So, but when I tried triggering myself, the mind, oh, the body said, and the cookie talking to me, I said, I'm gonna eat you, and then I'm gonna go push myself to walk around the block. So I walked for a year and a half during the pandemic because I was under stress. And the more I was under stress, the more I thought about it, the more I walked. So I walked off 25 pounds and didn't even know it in the inches. So I take that and I tell my sister, she used to work at night. We only a year apart. She walked with me. I said, if you can outwalk me, but I had to get in her head. She said, I'm so tired. So I pushed her and pushed her. So she lost about 20 pounds. But the end, she's not seeing. I said, don't look at my body because my body is different from yours because she got depressed. Oh, I want to look. I said, no, you don't want to look at me. But and she's a hard case, but I take what I eat with my life and put it towards her and say, and in my mind, I say, can I change her? Could I push it? So she walks on her own. Even though she's at the office, she walks to her car, she parks, and she go down the street. She'll park her car down the street and just walk or go around the block. I still today leave my house to go. I live in Richmond, to go all the way to Oakland to do the activity because if I motivate you and I'm helping myself, why not motivate someone else? Yeah. So,
It's really
and then
important
within the
to have-
neighborhoods, my neighbors see me walk. I see her walking. I'd be like, I need to walk with her. She's not walking. So I would just stop what I'm doing. If it's watching TV, homework, I say, hey, can I walk with you? So now we have 4 people walking. And she said, I feel much better. So I would promote physical therapy.
Yes, that's
Physical
a good-
activity.
That's a great testament to community and using your community for these things also. Matt, or Jennifer, what are your recommendations if someone in the community is looking for a physical coach or?
Yeah, so to echo off what Geneva and Jenna said, like there's tons of options, right? You can find them at your local health clubs or Yelp. Also reaching out to your own doctor as well. They can refer you if there's something internally for your health system. But in addition, like we have outside, right? Like Janice mentioned, you can walk or whatever it is, if it's swimming, whatever it is that you love to do, think of that, right? If it's you love to dance, get out and dance with some folks, right? Or dance alone in the street. If you like to walk and do that. I hike with a group called 510 Hikers right here out of the Bay Area. We hike all over the Bay, and it's open to everybody, every level. And I'm always like, come join us. But you guys are all welcome. And we have various levels. We call the turtles. They go slow and they start slow, but they finish strong. And we got the cheetahs that run. And so there's tons of options out there. But I encourage you to find something that you love to do that you're going to enjoy to continue. And once you find that, the nutrition, I always tell my clients this, like the first thing that you can do, especially if a dietitian or nutritionist isn't available to you, is start with food journaling. Like just take a time to like write down, there's apps, I use like MyFitnessPal, it's kind of free apps, right? Just write down what it is you eat in a day. Like don't change it. Just write it down. Like I had this for breakfast and I'm eating this for lunch, because we tend to overcompensate of what we're doing and like undercompensate what we actually ate. So like this gets to a point to understand what like the state of the state, like what am I actually eating on a regular basis, and then from there now you can start looking into like how do I make that one little change, or maybe it's a portion change or things like that. So that's my recommendation.
Very
Thank
good.
you. And then Maggie, any recommendations for finding a dietitian? I know it's difficult, as Janice was saying, with the limited number of visits that people can get. So what would be your recommendation?
Yeah, so first, again, I would encourage you to reach out to your insurance company and find out your in-network and out-of-network benefits. See if you have nutrition services covered. If you do, you can always ask your doctor for a referral. I will say cancer services, unfortunately, is usually not covered, cancer nutrition services by insurance. So I kind of tell patients to, if you have like a different diagnosis, like you're diabetic or you have hypertension, or if sometimes if you've been, it's just weight loss that you need, you can get your nutrition services covered that way. And then when you're in talking to that dietitian, if you have a cancer diagnosis, they're going to take that into consideration and give you that information. So, there's kind of little loopholes that you can use to kind of get in. Fortunately, where I work in Pleasanton, the cancer clinic I work at, I work under a grant. So all the patients that come in into that office, I see them kind of pro bono. But even the other Stanford locations don't have that. So it is hard for a lot of patients to get in. Another way that you can kind of look for dietitians in your area is if you go to, there's a website for the Academy of Nutrition and Dietetics, and it's eatright.org. And they have a little area that says find a nutrition expert. You can just type in your area that you live and whether you want to do like an in-person or telehealth option, and then it'll pull up all of the dietitians in your area, and then you can simply just call them and just say, what is your pricing, especially if you have to pay out of pocket, what is your pricing? And so you can get information that way. I know they had also mentioned, going to social media or going to YouTube and things like that. The only thing I would say with that is if you're looking for nutrition information, especially regarding some kind of medical diagnosis, make sure that it's actually a registered dietitian, because there's a difference between a registered dietitian and a nutritionist. A nutritionist does not have a license. They are not, they don't have a degree, many times. Kind of anybody can call themselves a nutritionist, whereas a registered dietitian, we've gone through intensive training, we have a bachelor's degree in some kind of nutritional science, we went through an internship, we're licensed. And so I just want to assure that you are getting evidence-based information and not just, fad diets or something that's actually going to cause more harm than good, especially when it comes to a medical diagnosis. That would be my only thing, that if you are looking online, just make sure it says dietitian. And maybe you can see their, make sure they have credentials, or you can see what their education is, just so that you're getting safe information.
Thank you all. And does anyone have any questions before we close out? So to repeat the question is during chemotherapy, there can be a metallic taste that develops, and what are your recommendations to try to mitigate that, and any particular dietary recommendations for that?
Yeah, this is very common. I get this from a lot of my patients, either metallic, very sweet, very salty, everything is amplified. In terms of the metallic taste, I would encourage, number one is to constantly, like throughout the day, do baking soda rinses. So just keep your mouth clean, brushing your teeth, oral health is really important. The baking soda rinse, just putting a little, pinch or two of baking soda in a glass of water, swishing it and spitting it out will help to kind of neutralize anything in your mouth and kind of get out any just yucky stuff in there. Also, when you're experiencing a metallic taste, eating less foods that have a lot of iron in them, because a lot of times people will say that they taste it, especially like with meat or beans. So just trying to eat less of those foods during that time. Another thing you could do is eating with, this is kind of always funny one, stop eating with metal utensils and use plastic, because sometimes the metal utensils will amplify that taste in there. So using plastic can also help to alleviate that. And then just making sure that your mouth is constantly moist. Don't let your mouth get dry, because during chemo you get that really, really dry mouth, and it makes everything taste really bad. So drinking a lot of water, drinking lemonade, or even eating lemon candies actually helps, or even just hard candies that kind of keep the saliva production going will really help to kind of just keep your mouth clean and moist so that you're not getting that metallic taste so much in the mouth. But the baking soda rinses really help a lot with that.
Great, thank you. Another question in the back?
Sorry, I was just going to summarize. So she was just saying that there is a woman, actually, yes, out of the Bay Area. I'm very familiar with her, Rebecca Katz, and she has recipe books, cookbooks, a website. It's called Cancer Fighting Kitchen, and she has a lot of recipes for people going through treatment to kind of eat for cancer prevention. But she mentioned that she did a talk where she focused on this particular topic about kind of taste aversions and just kind of what you can do to help with that. So yeah, she has a website. I think her name is Rebecca Katz, Katz. Her cookbooks are Cancer Fighting Kitchen, and she has a lot of different cookbooks, but she has a website as well where she has all this information. So a great free resource, and like you said, somebody who has really good experience in this arena and has really good information.
Yes, thank you. Another question? Okay, so the question is, how does sugar play into cancer? Does it cause cancer? What should we do as far as our sugar intake for cancer? Right.
I'm very excited to answer this question. I knew this was going to come up. So just to put it simply, no, sugar doesn't feed cancer. Actually, cancer, usually the primary energy source for cancer is fat. And again, this just kind of reiterates why it's important for us to decrease our body fat, because cancer actually feeds more off of fat than it does sugar. That being said, when you eat a really high sugar diet, generally you're not eating those cancer fighting foods, all those plant-based foods I mentioned, and all of those that have all those, benefits. You tend to not eat those kind of foods. So you're eating a high sugar diet, which is high calorie, causing an increase in your body weight and your body fat. So now you're putting yourself at risk for diabetes and heart disease and all these other conditions that, if uncontrolled, can start to mutate your cells and cause cancer. So it's more so about eating these foods, increasing your weight, increasing your risk for these other diseases, and not eating the cancer fighting foods. That's really where sugar can cause cancer. But it's not that you're going to eat sugar and it's going to cause your cancer to grow, especially during treatment. Like I mentioned earlier, sometimes I have patients that they're not eating anything during treatment. They're losing a lot of weight, and all they'll drink from me is a milkshake. And I tell them, you can have it, but once you're feeling good and once you're done with treatment, we're getting back on the healthier kind of plant-based diet. But they get scared. Is this going to cause my cancer to grow? And I say, no, especially during treatment, we're already taking care of it. I just need you to eat. But, generally outside of that, not encouraging people to eat sugar and eat all these sugars, but it's just, I don't want people to have a fear of it, but absolutely limit it, because there's really no nutritional benefits to it, right? There's no nutrients in it other than just that quick energy, but it doesn't have vitamins, minerals, all those other good things. So just again, to make it simple, no, sugar does not feed cancer, but a high sugar diet can eventually cause cancer down the road.
Yeah, just to add on, thank you so much. Just to add on to that, so sugar isn't a carcinogen. It doesn't cause you to start to get cancer. But when you consume large amounts of sugar, that can in turn, your body will turn that into fat. And that high amount of fat is what puts you at more risk. So you do want to limit your sugar intake, but just eating sugar is not going to cause you to get cancer. Great question. I don't know if anyone else wanted to address it, but any other questions? Oh, I have one more.
We talk about this all the time. So a gallon of water is a lot of water. We typically ask for 8 glasses a day. Sometimes I'll say drink your drink your weight in ounces or something like that. But obviously, the more water you can drink in a day, the better. But for those that can't drink water, and there's some people who just don't drink water at all, it's very similar to what Geneva was saying earlier. And Janice, like, start little, right? Like, can you start with this glass of water a day? You're doing a 1% increase, but you do want to make sure you're drinking more water. And then also to talk about the metallic taste, to get that your mouth cleansed, right, and to stay hydrated. These are all the necessities you need to like keep your body moving. So from starting from zero, you just start small because a big goal, you're not going to get it. So just break it up into chunks. But we do want to make sure we're getting at least 6 to 8 glasses a day.
So I wanted to add on that it doesn't just have to be water. Things like soup broth counts as a liquid. Obviously, any liquid you drink, but right. But things like soup broth counts. The ice you put in your drink, if it melts a little bit, that counts. Even things like, this is gonna sound funny, but ice cream counts because when it melts, it's turned into a liquid. So if you eat a little ice cream, that counts. Or even there's a lot of fruits and vegetables that are high water content. So things like melons, berries, oranges, they all will help. So again, if you're somebody that doesn't drink water, eating these types of foods, while it doesn't feel like you're drinking water, it is helping with you getting hydration. Cucumbers, tomatoes, things like that, which again have all these other benefits, but they also help with hydration. Or then I just encourage patients. I mean, if you have to add a Crystal Light packet to your water to make it taste good, or infuse it with fruit, that's okay. At the end of the day, you're still getting that hydration in, which is what's so important. So I think any little things you can do, even again, including it in food form, is still a way to hit your hydration goal.
Another question? So the app was called My Water Reminder. So thank you, that's a recommendation for everyone. If you need a reminder, download the app, My Water Reminder.
Everybody's drinking now.
I wanted to mention, when you talk, I love drinking water, but I learned to drink the 8 ounce. But some days I don't like it. So what I decided to do was through my, someone that does natural, alkaline, is to juice a melon. So I juiced a honey melon. I juice a whole watermelon, and I can get maybe 10 jars, no, I think it was 5 jars of watermelon. So vegetables you can juice. And with the watermelon, and then I also do coconut water. I'm a diabetic, so I have to watch the amount. So I get the coconut water, and I would put it, the one from Costco. I don't like the flavored one. The one that has the vitamin in. It seems like when I take it, it's like, I don't know what's in it, so I try to stay as natural as possible. But the one from says no sugar, I still put the water in it. And now I stay not dehydrated. So coconut water, and then if I don't do that, I take the watermelon when I get tired of looking at it. And the watermelon for diabetics, you can't have a lot of it, so I just, long as it looks like I know it's water, but I put the red in there to kind of trick my mind. And I drink that. But then I start juicing the cucumbers, and I start with all the vegetables. Whatever vegetable that has a lot of water, I would juice it. And it kind of helps me out. It's still the liquids that I'm trying to get. And then I start back with the water. So I play with it. I play with a lot of the fruits.
Great, those are great recommendations. Okay, so we're a little bit past time, but thank you all for joining us today, and thank you to our wonderful panelists for everything. If you didn't get food, there's some boxes in the back. Please fill out the rest of the survey, and we would like those before you exit. There is a post-panel questionnaire, so please be sure to answer those. And this is the next event that we have coming up, so be sure to be here for that. We have one of the medical oncologists who will be speaking about treatments and innovations in breast cancer. So this one should be really exciting also. So that's next month, also here in the Now Room. So thank you all for joining us, and have a great rest of your Saturday.